I'm Madeline Stewart. It's time to check in with our friends at MUSC Columbia. Today we're talking about a very important part of the body, the thyroid. Dr. Rowe is here to tell us more. Thanks so much for being here.
Thank you for having me.
So I think a lot of people don't really understand the thyroid and its functions. Tell us about that.
So the thyroid gland is a little gland that's butterfly shaped that sits on the base of your neck. And most people don't even think about it. And what makes it so interesting, though, it controls so many different other systems and impacts so many other systems of the body. Everything from cardiovascular to even like your energy levels. It also affects your digestive system, mood, and even skin and hair, nails. And so we don't a lot of times put the importance of how important it can be, and sometimes the symptoms, because a lot of times the symptoms are so non-specific, meaning that you can have symptoms that may be related to the thyroid or not related to the thyroid, but yet unless you actually get it evaluated, it's hard to know that.
How would someone know that they need to be evaluated? Maybe what kind of symptoms would they be experiencing?
So, just to kind of make the long and short of it, even though it's definitely not a long and short topic, but there are issues with overactive thyroid and issues with underactive thyroid. And so take, for instance, if we looked at underactive thyroid, which basically means that your body is not producing enough thyroid hormone, which means that your metabolism is slow and that you can be sluggish and fatigued. Some people experience constipation, depression or worsening of depression symptoms, dry skin. They can have a slow heart rate. They can have just a whole variety of types of things. Now let's go to the other spectrum, right? So overactive, meaning that your bodies are hyperthyroid, means that your body is actually overproducing or being overstimulated by the thyroid gland. So when we look at that, people can have tremors, they can have elevated heart rate, they can have a lot of anxiety, the palpitations, diarrhea, they can have a lot of kind of emotional irritability, so to speak. And so when you have any of those symptoms as well, again, at least one of the things you would like to think about is the thyroid, because there's blood work, and a lot of physicians on routine annual labs will do annual screening labs anyway. And sometimes because of what a patient is experiencing, they may have to have more in-depth lab work done to have a more detailed evaluation of the thyroid.
Now, what causes damage to the thyroid? Is it hereditary?
So that is a whole bunch of different things. Everything from medications to there are some that are forms that are more hereditary. There's a higher prevalence in women actually than men, and we also see it in kids as well. But definitely women tend to make up the majority of thyroid cases. And then you also have to think about not only medicines that can impact, but a lot of times even the things that in the environment we have a lot more exposure to chemicals and things in our environment these days than we did even 20 and 30 years ago. And so what we find is that there's starting to become a higher prevalence of more autoimmune types conditions anyhow. And one of the most common forms of thyroid disease is Hashimoto's, which is an autoimmune form of more of the underactive. And on the flip side, for the overactive autoimmune is the Graves' disease. So there are, but in the answer to your question, there could be lots of different things, and a lot of times it's hard. It may not be necessarily one of those things that we're able to tell, why you had what you have, but I think the most important part is that, especially if you find that your levels are abnormal, to see whether or not you need to have medication versus is it something that they just need to watch your levels for.
Now, on the flip side, if someone does have a dysfunctioning thyroid, can that cause other issues?
Yes, and it can cause other issues in different parts of your body. For instance, the thing that we don't want to happen, of course, is difficulty or problems with your heart. But really serious thyroid conditions can definitely play a role in the development of certain heart conditions or cardiac conditions. So that's for sure. Then also, as well as, it can also affect the GI system. So depending on, overactive thyroid tends to present more with diarrhea. Underactive thyroid can present more with constipation. Then we think about, your thinning hair or dry skin. Those also can be a factor of your thyroid. So when you think about your mood and having a depressed, like people who have depressed mood, and even though depression, of course, can be caused by a lot of different things, one of the things we want to make sure that it's not being caused by is the thyroid, because that's something that's easily treated.
And what are the treatment options?
So, the most common thyroid medication for underactive thyroid medicine tends to be Synthroid or levothyroxine. That tends to be the most common. There are also some other things that are like Armour thyroid or NP thyroid, but the most common thing that we use these days tends to be Synthroid or levothyroxine for people who have underactive thyroid. Now, it's kind of interesting for overactive, the methimazole, which is one of the medications that's used, but it also depends on what the treatment is. A lot of times, sometimes the endocrinologist may recommend people getting their thyroid irradiated so that, therefore, at that point, they may have to go, their thyroid is no longer overactive, it becomes underactive. And so, but what is important is that when we look at treatments, because those are treatments from a medicine standpoint, there are also some treatments that in some people they require surgical intervention. And so like with goiters that tend to be compromising the airway, they may need to have a part of their thyroid removed or completely removed. Sometimes if they have a nodule, those may need to be monitored, or depending on if it's something concerning, some people have to actually get something called a biopsy, and which to take a look to make sure that there's no types of malignant cells and that type of thing. So a lot of times it kind of depends on what type of thyroid condition that they're experiencing to see what are the best options available for them for that.
Now, if someone is able to determine with their doctor that they are experiencing thyroid issues, how do they get in touch with you and find you?
So I am at MUSC Primary Care off of Clemson Road, and we love our patients. We love new patients, and we love our established patients.